And a good early evening from Gold's House in Abu Dhabi. I'm John Defterios, the emerging markets editor for CNN, and we're joining a global network of Gold's Houses around the world: New York, London, Berlin, and Kigali. I want to thank Abu Dhabi and the Gold's House here at Hub 71 for the invitation to delve in at a very critical window in the COVID-19 crisis and looking at health technology, specifically the global pandemic and how it's fast-tracked the health tech revolution. We're at a juncture in time here, September 2020, which is a unique juncture in time because it is the 75th anniversary of the United Nations, with the United Nations General Assembly taking place in New York as we speak, and the 5th year since the global goals have been set forward in the Sustainable Development Goals and everything related to it. And right at the heart of that, of course, is health. We have a fantastic panel of 3 guests here in the Hub 71 studio, and 2 joining us from overseas in Geneva and in London. Let me introduce those guests now. First in Geneva from the World Health Organization, Bernardo Mariano. He's the Chief Information Officer of the WHO. Dr. Jamal Mohammed Al-Kabi is the Acting Undersecretary of the Department of Health here in Abu Dhabi. Welcome, it's nice to have you here. Patty O'Hare is the Global Head of Communications and Government Affairs for RB, which is Renket Benkeizer. She's joining us from London. And in our studio here, Dr. Farida Hosani is the Director of Communicable Diseases Department at the Abu Dhabi Public Healthcare Department. Good to see you again. And Ashish Koshi is the Chief Executive Officer of G42 Healthcare on the other side of our studio. I don't think we could have a better panel, actually, and at a very critical juncture because of the second wave. And I'd like to go first, if we can, here to Geneva and Bernardo. Let's start with the big picture and the thematics of our session today, Bernardo, if we can. And are we seeing actual evidence of healthcare being jump-started by technology? This is the ultimate test. Is it paying off with the investment we've seen over the last decade in particular?
And thank you for having me here, first of all, and good afternoon, good morning to everyone. And let me maybe start by quoting Dr. Tedros, who said that lack of unity is a bigger threat than coronavirus. So that's one of the areas that I think as a global community we need to do better. We need to deliver better to really address some of the challenges with the coronavirus. In terms of what do we see how technology supported or is supporting the response to this pandemic? One, we've seen unprecedented support and engagement from private sector to support all the health sectors, both at national and global level, to accelerate and through technology the delivery of tools and solutions that will support the challenges the pandemic brought to us. Contact tracing is one of the areas. Chatbots, health-related chatbots, that's the other area. From WHO perspective, thanks to the private sector, we had tremendous support that allowed us to create a WHO Academy app to deliver knowledge, which is very key to healthcare workers all over the world on the areas that were needed for these communities to address the pandemic. Of course, we need to remember that around 46% of the world still are not connected to broadband, so they don't have access to digital solutions. So we need to remember that as well. So of course, with that in mind, the collaboration and partnership to when one end to make these tools that we currently have deliver the best health outcomes. We need to ensure that contact tracing, for instance, is an integral part of a public health response and not just a technology response on its own, because then you don't have the benefits. We also need to make sure that the whole culture between the tech industry, which is very used to hype, and healthcare industry that is very used to precision and do no harm. How do we bring these two together? So we had unprecedented partnerships, collaboration And we continue to foster on that to ensure that we bring the best out of each sector to deliver a better response now, but also to prepare for better response in the future.
Great, thank you, Bernardo, for that. I'm going to ask the panelists, after that fantastic umbrella discussion about technology, let's try to keep our answers to about 90 seconds, and then we can foster a back and forth debate amongst us to delve deeper into this concept. I wanted to bring in Dr. Jamal, and I thought what was interesting is I'm a resident of Abu Dhabi, and you could see the response that took place. Did technology actually help you gather information what was preceding us here in the Middle East or in West Asia from the Far East? Did we get a sense, because of technology, the threat, the timeline, when it would arrive onto the sands of the UAE?
Yes, first of all, welcome to Abu Dhabi. Thank you for hosting us. I think this pandemic, I will agree 100%, it did accelerate a lot of things here in Abu Dhabi, especially in the area of technology and people believing the value of technology in promoting healthcare in Abu Dhabi. Exactly. One of the major things that we did here, actually, the telemedicine, where actually we ask our elderly to stay home and not to visit hospital and use this service. This actually helped us a lot to protect them actually from coming during month of May, for example, where actually the number of COVID cases was at highest. And then this technology, by implementing it, getting the support from the private sector also, and helping us in coordinating all the effort with all the different groups here in Abu Dhabi, I think this actually gave us a sense why we need to focus on this, not only during the emergency and pandemics. It is something that needs to be implemented in any healthcare system. Before the pandemic itself, I got my doubt, for example, in regard to the telemedicine and the value of telemedicine. There are different providers who actually were trying to convince us about this value. But actually, during the pandemic, this showed us clearly we need to improve in that regard, and actually we did it. And right now, we consider this an opportunity to improve more and more. We used also a lot of other things in communication, like chatbot, using AI for diagnosis and radiological finding of COVID patient, which was actually with group 42. And actually, this is something we never tried before. It was something new for us, but it shows how it is really important for any healthcare system. In order to achieve the excellence itself, you need to have the technology side by side with the healthcare system.
Well, it's an interesting point. Dr. Farida, maybe you can comment on it, and I'll bring Ashish in from the technology side as well. How do you strike the right balance of privacy of an individual and the need for tracing to stay ahead of the disease, kind of living with COVID-19 before the vaccines come? So I'm sure that's a debate here in the UAE, a debate amongst the Emirates, but what thought has gone into it and say, look, it's the security of the citizen first. We have the technology that's available, but there's also a privacy issue. What sort of debate is taking place within the halls of the health community here?
Definitely, when emerging infections comes, we have a lot of uncertainty and vagueness. This really helped us to try to use technologies to enhance our response. Yes, there has been a global debate about how we can really preserve the personal privacy, and at the same time we use the technology, and it has been practiced differently across different countries. I think our model here in Abu Dhabi definitely tried to reach this kind of a balance where you want to enable the person and the individual to have the decision, to make the decision to share his own information, try to use education and awareness of the public to help them to use those technologies as well. So enable, encourage first, and then try to engage with them.
Quick follow-up to you then. It's a trust factor, right? You have to have a trust in your government to be able to put that much technology at play. Would you suggest that's the truth, Farida, that people have to have the trust in the government to say, I'm willing to do this for security purposes?
Definitely, and again, their behavior is really one of the determinants of the spread of the disease. So definitely we need to create this channel of trust between the individual and the governments.
Good. What's the role of Group 42 then in the collaboration with Abu Dhabi, so we understand it? And is that technology, Ashish, transferable obviously to other markets? What's the experience? What's the request in terms of innovation and development to go to the next stage of what's needed in this fight?
First of all, good evening from UAE and to the viewers of Gold's House. I'm just following up on what Dr. Jamal said. Absolutely, I think it was a perfect synergy. There was a need for, say, pushing forward health tech once the pandemic hit. There was other than telemedicine, AI imaging, as Dr. Jamal said, we worked with the hospitals here to deploy chest X-ray detection and lung CT detection so that we could relieve the workforce in terms of radiologists, because once the surge started, we had cases coming in frequently. So the images need to be diagnosed very quickly, and it fit in right at that time where we had AI models ready in place, ready to be deployed. One very important thing to mention is we are blessed with progressive regulatory bodies which allow for innovation and allow for solutions like this to work immediately and to be plugged into the system very quickly. And that's one of the major reasons why Abu Dhabi and UAE specifically is one of the most safest countries with respect to COVID-19.
Good. When we talk about public-private partnerships, do they actually say, what do you need from us? Did the government say, Ashish, what do we need to do to make your job of innovating and helping us go more smoothly? What was done?
I think it's the other way around. The government just tells us the business problem and we are there to support, and that's how it is. And we make it happen. And I think that type of synergy is seen only in the United Arab Emirates, and especially with leadership like Dr. Jamal at the Department of Health. We understand what the problem is and we sit together and break it down and plug in the solution as soon as possible.
Wow, it's interesting.
No,
go ahead.
There was another point I wanted to touch upon also. Before the pandemic, the benefit that we had, where the Department of Health had initiated the population genome program, which was very beneficial. Once the virus came into this country, we were able to sequence it and understand the mutations. And that was health tech in place at the right time. And that's why it worked a lot here.
Good. Patty, you're one of those people that's traveled around the world, probably 50% of your time in the role that you have at RB. And I can remember going to airports and saying, this airport, whether it was in China or India, I said, this is too crowded. The airplane's too crowded, right? We're all on top of each other. And then there's a whole issue of cleanliness, the new behavioral change, whether it's going to be permanent or not. This is your specialty, Patty, from RB. Is it long-lasting change? Because we're looking at airline patterns and passenger patterns and the rest. But do you think it'll be long-term change when it comes to sanitation, healthcare, hygiene? And it's obviously different between a developed economy like this and the developing world. What do you think, Patty?
Yeah, I think there are two driving forces. One is around access, and that's the ability to have access to infrastructure so that you can enable you to practice good hygiene. Second is, as you rightly said, is around behavior change, and that's the adoption of behaviors which will actually improve health outcomes. So unfortunately, 40% of the world just does not have access to facilities that enable good hand washing and good hygiene practices. And 36% of schools, for instance, don't have facilities where children can regularly wash their hands. This then exposes 900 million children to the raw challenge of how do they stop and break the chain of infection in a very crowded environment like you've talked about. Now, when we're talking about behavior change, it's one of the hardest things in the world actually to achieve. And as we think about COVID and how we've all changed our behavior rapidly, almost overnight, with everybody washing their hands for 20 seconds and beyond, we know that if people adopt a behavior for in excess of 60 days, it's likely that they can then embed that behavior in terms of their normal everyday practices. So that's a very good thing. But you know what? We didn't start from a great place. Globally, only 17% of people regularly wash their hands, and that's in the developed world as well, after using the facilities. That's 17%. 99% of people will tell you that they regularly do. So we have a gap between what people actually do and what they say they do. 46% of children are washing their hands, but they're not using soap. So in fact, if we're going to resonate and really make sure that we have that kind of lasting impact, we need to make sure that we're, one, creating the access to the facilities, and two, using tech, but also using other behavior change and education programs so that we can reinforce those lasting behaviors.
Thank you very much for that. And I'd love to have both you and Bernardo answer my next question. We'll start with Bernardo here. As the emerging markets editor, at the very beginning of the pandemic, I could recall saying on air that we have major populated countries, Brazil, Indonesia, India, you can go Nigeria. The challenge is huge because of the dense population and the strained budgets. So Bernardo, what needs to be done on the technology side that can advance and help these countries leapfrog after the vaccine is even done, but to leapfrog their technology systems? And I'm worried about the have and the have-nots, to be candid here. Everybody's been cocooning and taking care of their own, financially at least, in terms of economic stimulus. How do we make sure through the WHO that this is not a gap that is permanent as well in the developing world versus the developed world?
Actually, I would even say that let's make sure that the gap is not exacerbating. So we don't increase the gap. So let's make sure that the low and middle income countries, they leapfrog with the technology. I think if you look at the implementation of a technology such as fiber, you have lots of countries in the telecom industry where developing countries leapfrogged developed countries in adoption of new and latest technology. So that is not something that it hasn't been done before. It has been done before. The question here is, how can we ensure that in the process of implementing the technology that will allow healthcare sector to leapfrog in least and develop in middle income countries, how can we ensure that it's done in such a way that the trust element is there, you just mentioned, the privacy and ethical considerations are well in place, and in ensuring that the adoption of such technology will bring the positive health benefits. From WHO perspective, we have global strategy of digital health being approved by our member states, our 194 member states. It was approved by our executive board early in January, and is going to be to our World Health Assembly in November, and that brings two elements that I will just mention here in addition to the number of others that are there. One is maturity level of a country. So investment on digital health in a country has to make sure that addresses or elevates the maturity of the country from wherever the country is to the next level. So we have, as part of our global strategy digital health, a dynamic maturity level index or dashboard to ensure that we are able to measure these investments in digital health in each country, but also we ensure that they bring positives, and then the maturity level increases from where they were before to where they will be next. So this is one area, in addition to other areas where we want to ensure that that global strategy on digital health, the implementation, the roadmap, has enough investment. We build partnerships around it, and we don't duplicate, and we break the silos of that we see very much in the healthcare sector.
Very good, thanks. Patty, I wanted to follow up with you, and you mentioned something in our very brief pre-discussion, that the have and have-nots in the developing world, actually there's a gender split as well. So what's the research being done here in less developed countries and the impact it's having on women and teenage women or girls trying to go into advanced studies as a result of the pandemic? What's the research showing us here, and where can technology help on that side?
Wow, big question. Listen, any pandemic amplifies existing inequalities. It not only shapes who's affected, but the severity and what the recovery trajectory looks like. And I think that's really, really important. We talk about digital tech and how it can be both an amplifier, but also it can drive further health inequalities because of access, issues about access. There are three basic, barriers or causes of that growing divide. So whether it's lack of access, mostly an inability to pay for the service or a device that will enable that access, lack of motivation because you don't think access is really important to you, or education and lack of digital skills. So we really need to look at how do we make sure that we're reducing these inequalities. And you rightly said, we see 1.5 billion children right now that are not in the traditional education format of going to schools. Many are being homeschooled, but many don't have that opportunity because if they're home, if we're talking about Africa, then in many cases, girls especially are then adopting more domestic duties. And so therefore, we're seeing a case where millions actually won't return to school when we ever return to what we used to call as normal. So I think what we are seeing is actually a real deficit in the future of young people in those areas where that discrepancy and where that divide is. And how do we ensure that we don't lose a generation to COVID, and the impacts will be far reaching beyond those who are directly affected by the infected.
It's interesting, you're a technology person, Ashish, and we learned two things during this crisis, right? We've talked about e-learning forever, right? But it was never implemented because we didn't have a crisis to push us into that direction. And then you see in the developing worlds in particular, but even in developing countries like the UK or the United States, healthcare systems strained beyond belief. If you got behind the curve at the front end of this, it's hard to get ahead of the curve again, right? What can technology do here in these markets that are fast growing in terms of growth, but that didn't help the healthcare systems to withstand such a test from the pandemic in your view? What's realistic from your vantage point in working here in Abu Dhabi?
So with respect to healthcare systems in Abu Dhabi, I think the Department of Health Abu Dhabi had engaged on this platform called Malafi, which was in place, which connected multiple hospitals into one single platform. And that helped a lot. And I think taking that at scale, because health information exchange and electronic health records on a single platform across the hospitals connected in one single place, I think that would help a lot in terms of visibility, because decisions from the Department of Health and from Dr. Farida's level had to be made based on data. And I think as long as we can get the entire data set on a single data source, accessible to the regulatory authorities, and absolutely that should be a step forward in taking the right decisions at the right time. But we have already started that here.
That's very interesting, Dr. Jamal, because data before used to sit in a silo, right?
Yeah.
In government. So have you learned now to information share as fast as possible when necessary?
I think what is good about Malafi, this is a platform we created. We created it before the pandemic itself.
Good.
So it came in action on the right time, where actually we start also fixing all the hiccups in the system, and we get the data so we can help public health team realize the magnitude of the testing, positive cases, and everything was presented to us through the system. And then the team was every day we were actually spreading these information from that platform to all the leaders so we can understand, we speak the same language. And actually in the beginning, we try to tailor this system to the need of the pandemic itself. So for example, some question raised at the beginning is those with group O positive prone to the risk of COVID-19 or not? So we just do the fix within the system to get the information for us and do the analysis. It was obvious, and the answer was in front of us during the analysis itself. Future study about the progression, about what to expect in the coming month, the curve itself, everything was actually based on Malafi data. So this is actually where we say here in Abu Dhabi, one of the beautiful things that we did is preparing ourselves for the pandemics.
Wow, was your R&D level of spending correct then on the technology side? What did we learn? Too much, too little, just right? How strained was the system at the beginning?
Yes, R&D, we always think we are spending too little. We need to spend more. And this is actually right now the opportunity. to convince.
Everybody who controls a budget wants to spend
Yes,
more, right? I'm
yes.
sure you've heard that
Yes.
from
Right
the
now-
Ministry of Finance, right? No, but is it the truth that you're having to spend more, though?
Yes, and we are spinning right now a new research center, actually, away from the regulator to focus on the study. Right now we are doing clinical trials for the vaccine itself. This is something new here in Abu Dhabi, but we did it. And we are continuing promoting the research here in Abu Dhabi for our healthcare provider. I said this previously. A healthcare system without a strong research is nothing. You need to depend on the research itself, promote this within your healthcare workers so they can improve and they can find solution for all the different public health issues that they face every day. And then we need to implement based on this research, or whatever we are discussing through our meeting now, right now, is based on scientific research. This is what we want to do, and we will continue improving on that. This is why we need to spend more and convince the government that any dollars spent on the healthcare system research will have a reward at the end, because you are fixing an issue that will last forever.
Well, Dr. Farida, in fact, one of the things that you have as a specialty is that people talk about the right level of R&D from the side of this challenge in the pandemic. How did you do in terms of gauging or benchmarking yourself in your department on the right level of research, right level of development, and what needs to happen next?
Definitely, we have a good understanding of our gaps and challenges within R&D investment, as Dr. Jamal highlighted. But also, we needed to reshift our focus on investments during the pandemics. I think there are major 4 areas or priorities of research and R&D that we were focusing here in Abu Dhabi. This included the healthcare infrastructure, technologies related to increasing capacities, increasing ICU beds, instrumentations, and also disinfection technologies. The other area is the communication and risk communications with the public. We needed to use technologies, social media platforms. We needed the innovation to focus on this area, and we tried many things. The third area is about the surveillance and the contact tracing, and definitely the landscape of this service has dramatically changed with time. And the last 4th area is a new R&D and technologies focused on diagnostics, treatment, and prevention as well. So I think being focused during the epidemic is one of the main success factors for Abu Dhabi.
Bernardo, Mariano, I'd love to have you kind of share some ideas of what we've learned in different governments using technology to ramp up. The 4 of us sitting in the studio here could see, for example, the Seha medical system really get the testing facilities up in a hurry and get people through the system with the technology and the app within a short period of time. 10 minutes is usually the time from driving in to getting out. What have we learned from different markets around the world? What information sharing is taking place through the WHO when it comes to information technology, using a case study of, say, the UAE in testing, and what can work in other parts of the world? What are we taking away from the pandemic on that side?
Let me just reiterate what was said earlier around preparedness. I think the success of many technology that we saw scaling up during the pandemic, it was because they were already being introduced in a number of countries. So that saw a greater rate of success. We also saw some success in technology that were introduced as a result of the pandemic, such as contact tracing, symptom checkers. Those technologies, as well as bots and others. So these technologies that was introduced during the pandemic, and many countries did introduce, including WHO, we promoted in a number of countries. We saw that the combination of public health response and technology was the key for success. In Abu Dhabi, I think, is one example, but you have also South Korea as other examples. And we saw also failures of technologies in countries where the technology alone was trying to solve a public health problem. And that's where we saw low adoption and actually no value added to of the technology to health systems. From the WHO perspective, and the lesson that we're taking, some of the areas that we changed the way we do, for instance, is solidarity trials. So how can we fast track trials in ensuring that we go through the rigorous process that is required for clinical trials? So how can we bring that into? We created this solidarity trial to ensure that we are able to provide to the world a mechanism to fast track, and using AI to do that fast track. But the area that we still need to do better is data, especially governance of data, and how can we not just data at a national level. Let's not be happy just because one sector, one city, or one country is doing better on health, because one of the lessons that the pandemic is teaching us is there's no such a thing as safe haven when it's about a virus. So we need the whole world to be able to leverage on those technology in good governance and data to ensure that if an outbreak of a virus takes place in the most remote area of this world, it does not propagate like the way the pandemic was propagated. So therefore, investment on preparedness, and we are working with a number of member states, but also development partners, to really enhance our preparedness, the alert system. Today, weather system has a better prediction compared to health systems. That's not acceptable. We need to do better because health impacts everyone. It's true, weather system impacts a lot of people as well, but the pandemic is showing that the countries in the whole world can come to a halt just because of a coronavirus. So those are some of the areas that we see. We are working together with the whole new data governance. It's something that our teams in WHO are putting together to ensure that data for AI, data for prediction, data for surveillance, disease surveillance, is available to all countries and can timely make an impact for all countries. Thank you.
Great. This is very interesting because it leads me to an aspirational question, if you will, here for our panel with me in Abu Dhabi here at Goals House, and also in London and Geneva. Let's be aspirational about the vaccines and development, and we're at the later stages here in Abu Dhabi. Where does technology come into place for distribution of a vaccine? Because this is going to be a challenge to reach everybody in the country. So I'm sure you're thinking about it, Dr. Jamal. Give us a taste in a country of 10 million, and the vaccine gets to its final stages. How do you get the data that Bernardo was talking about here to make sure that those most vulnerable get the vaccine? How fast you can get it out? Do you use the school systems in which to do so? Give us a taste of what you're planning for.
As I said, the beauty of Malafi that we are using, we can get all the information we need. We can categorize it. For example, if we decided to give the vaccine for elderly, we can get the information from the data itself. Right now, what we are doing for the trials is monitoring using the technology itself on the follow-up, because this vaccine right now during the trial has 2 doses. So how you can make sure that those who are coming for the first shot will come again, and maybe they don't see any improvement, or they see side effect or something like that, and they decide not to come back, and this will have an impact on the clinical trial itself. So you need to promote this and keep also educating them about the value of clinical trials and so on. So we use an app, and we implemented all the information for those who get vaccinated through Al-Hassan program that we are using here. So people actually realize that they are volunteering for this, and this actually brought the trust that you mentioned in regard to whatever we are doing here in the government. And we put like a gold star for those who are using or as a volunteer, and it was a human touch, and they loved it, and they actually continue. Today I'm seeing those who came actually for the second shot almost 100%. So we use that data, we use all these type of communication to send messages about the vaccine. It's really yet under trials. You need to take care of yourself. we spread all these information through the app itself. And it gives us also data about the PCR test, how many times they did it, all the serological tests that they're doing. It's coming also through Malafi. We can see the result. So I think technology is helping us in that regard. Right now, the moment we get the approval, the challenge will be how we will spread this vaccine to everybody. And I think we know where to go because of all these information available in Malafi.
Very fascinating to watch. Dr. Farida Hosani, I'd love to get your thoughts on what if we didn't have technology in the system and we were hit by a pandemic?
I think
what would have happened if we, at such a global scale, and the reliance, which I'm learning through the conversation here on data, what if you didn't have this toolkit in such a voracious pandemic because of globalization, because we all traveled around the world, right? And the spread was fast.
Yeah, exactly. I think this we will be ending up behind the disease. Technologies enabled us to be faster and more efficient in our responses, where we have a targeted approach. One of the unique examples that we tried here in Abu Dhabi is the focus on the vulnerable population at high risk, where we did active case finding using the healthcare data system that is available to identify elderly and also chronic diseases patients and go find them and screen them to make sure that we intervene early on to prevent mortalities, and this is one of the proactive measures that we can take, and we could not take it without advanced technologies.
Interesting. I'd love to have our private sector folks here, Ashish and Patty, answer the next question. And it's provocative for me to ask the private sector, but I'd love to hear a private sector view about how there's a lack of global collaboration amongst different governments. Everybody seems to be anti-globalization, not embracing the UN on its 75th anniversary, complaining about the World Trade Organization, the IMF, the World Bank, you name it, right? This is the narrative. From the private sector standpoint, what benefit is it between private and public sector collaboration on technology? But what would you like to see from more collaboration on governments as opposed to the initial reaction of cocooning, which was really a dangerous reaction, I think. Ashish, do you want to start, and I'll have Patty jump in.
Yeah, so the initial reaction, like what you mentioned earlier, was we need to stop it in our city, at our home, and the focus is on stimuli around our home or the capital. But there has been collaborations within from Abu Dhabi with multiple countries in terms of just scientific research, as Dr. Farida said. We've collaborated with partners in UK to come up with a new testing diagnostic methodology for testing, which is going to be announced soon, which is tackling the turnaround time, possible issues with PCR testing and accuracy, combining sequencing and PCR from two different countries. We've also collaborated with China for the vaccine trials. So clearly collaboration is there, but I think it's the issue about to what extent we should take it, because we have to take into consideration it is home first and then beyond. But I think that is the biggest challenge, but I think collaboration has always been there. It is an issue of how much and to what extent and to what scale. I think that is the concern here.
Good. Patty, I've known you for your work in the past. Is this a crisis of globalization that will hold back innovation and private and public sector collaboration as a result of the protectionist tones we see around the world? Is it seeping into healthcare technology?
I don't think so. Actually, I've seen unrivaled opportunities where I've seen greater levels of collaboration. I think that nothing like a good crisis to be squandered. So what we do see is we have, for instance, partner with a number of governments, certainly in the Middle East, in terms of behavior change. So we're working actively with government in terms of how to promote hygiene habits in schools. How do we promote just the basic understanding of how we can all break the vector and the chain of infection. I think people just went about their daily business not understanding how many different touch points you have during the day and how often you have to drive hand washing. Second area is around product and availability. I think whether it's soap, making Dettol soap available, or whether it's making sure that all of the basic hospitals and clinics have access to all the disinfectant products they need in order to keep themselves and their patients safe. And then finally, we have worked with a number of governments in terms of helping to procure PPE and other essential products to make sure that we keep, our frontline health workers really safe. And then finally, we have participated in a number of cross collaborations. That's governments, that's private sector, that's everything. One of them is called the Trinity Challenge that we're driving out of the UK with the University of Cambridge. And this is really a hothouse of innovation that's going to cross all from AI, using digital and health technologies in order to not only have a better response to the next pandemic, because I think we all acknowledge that what we have to do is we have to maximize the learnings and really fuel future innovation so that we have a better response to the next pandemic.
Bernardo, Mariano, let's see if we can summarize our conversation here on, because of the data research that our experts here on the panel have been talking about here, how do we live with COVID-19 in this very critical window between now and when the vaccines become pervasive? What is life, what are we learning from the technology in terms of getting through this stretch when vaccines are widely distributed, not only in the developed, but the developing world? What's the data showing us in your view of how to live with this challenge?
The data is showing us that of course we still going to have challenges even when the vaccine comes to it passes all the clinical trials, especially on prioritization and ensuring that the right people that need the vaccine get the vaccine. So I think that's the challenge that we're facing. And now we are working on two fronts in relation to that challenge. One is the supply chain challenge, right? So how do we get the vaccines to the right place? But here I want to put a message that we want, for the world to be safe of COVID-19, the person that is in most remote area that can carry the disease needs to be protected, must be protected. So it is our responsibility, joint responsibility of all the world, together with WHO, to ensure that a safe of one nation is not sufficient for that nation to sit down and relax. So supply chain is one. The second is prioritization. But of course, we are also working in other areas such as digital technology for immunization records. So because that's the next one. We had a number of governments and countries coming to us saying we should create an immunization passport. But we need to actually leapfrog, not even leapfrog, transform the whole immunization record from the traditional yellow card vaccine that the WHO introduced, many countries use, into an immunization record that is interoperable across countries to ensure that, one, the needs of the vaccine is addressed through the supply chain and through prioritization on the people that need the vaccine. Then two, the ability for countries to interoperate in terms of who is immunized or not is also use the technology to then come back to a normal or new normal post-pandemic.
Ashish, that's a very interesting concept, though, because you're almost saying, Bernardo, an immunization passport, but a digital one, and making sure that's trustworthy as well. Isn't that quite a steep challenge in the middle of a pandemic, in your view? Or can it be done?
Definitely. I think we in Abu Dhabi have already started it as part of the clinical trial, as what Dr. Jamal said. All the volunteers, it's not a full-fledged immunization passport, but at least it's a proof of that he's a volunteer and he's been vaccinated, the first dose, the second dose, and that's the start. We have integrated our data in the right place, and that's why at the moment when we have a requirement like that, it's easy to fix. We have the apps ready, we have the back-end infrastructure ready, we have predictive models ready, and it's easy to deploy that. Once, as Bernardo also mentioned, we need that health infrastructure in place, and that's here. And that's the reason why it's quick to implement such solutions as what he had mentioned.
Yeah, go ahead.
This is really important point here. Bernardo mentioned that, okay, we developed the system here in Abu Dhabi, we have our app. What if I travel to another country?
That's that's the point I was trying to get at. Yeah.
What is the value of that for other country? And this is really something we need to work around a solution, universal solution, where actually, as we mentioned, universal passport, whether digital or something else. But right now we have the technology, as Ashish mentioned, and it's working actually, and we can tailor it according to our need. If the vaccine proven to be the vaccine that will help the humanity, then we just put 3-star and would show that there is an immunity and you can move freely and you can go to the malls, the hotels and so on, and it's open the doors and bring normal life for everybody. But is the issue right now is the travel restriction. How can that be also make possible while we see also the different number of cases?
Well, it's an interesting point that you bring up, and I'd love to hear Dr. Farida's thoughts on this as well. IATA yesterday, when my reporting with CNN, they wanted to go to a global standard of testing before anybody gets on a plane. And I was almost laughing because that's what we've been doing here, right? Was it 3 or 4 months? Is that possible to get the global scale after the experiment we've had in Abu Dhabi and Dubai in particular of having a test before you get on a plane? Is that scalable, Dr. Farida, in your view, globally?
I think it will really depend on the global interest of countries. Especially the developing country will be a challenge to have labs that are reliable in those countries. But definitely this have been implemented for months here. And this is one of the useful measures to try to facilitate the movement of people. We cannot stay in isolation for a long period. We need to find innovative solutions, and we need the data to be shared between countries with regards to the testing, with regards to the immunization, that will help us to make the passenger experience much easier.
Okay, let's bring in Bernardo Mariano Jr. again from the WHO. I'm wondering, and I'd like to go back to Patty's first point about permanent change when it comes to hygiene, right? But what's the permanent change? I chaired a session with 4 leading CEOs about a month ago, and they were talking about the economic damage even going into 2021 and spilling over to 2022. But what's the data showing us now about how long lasting the change will be about air passenger changes, schooling, how much is going to be e-learning, a week from home, a week at school? Right now, it's all e-learning here in Abu Dhabi, for example. What is the right balance as we get a vaccine and move out of the pandemic? What is your thoughts on this? And is the WHO looking at the permanent changes, behavioral changes, travel changes, hygiene in restaurant changes, right, in the malls? What do we see coming out of this at the end of the day?
At this stage, we have, I mean, the evidence is not strong enough. I think Patty mentioned a number of examples where, I think from the research perspective, we need more data, right? So from the research perspective to really create that evidence. But on the other hand, we have guidance right now. Guidance based on the little evidence or the little observations that we have from countries, and of course it is dynamically changing as we learn more and more about the pandemic. Now, we of course want to make sure that the good practices on hygiene, hand hygiene, and others are permanent, because that is one way to ensure that the next pandemic we can much faster implement measures that will not result in spread of the virus as it happened. But at the heart of everything is the trust, because if the countries where the pandemic was well managed were countries where the public trust in relation to the public institutions, governments, and others was already somehow there, and therefore introduction of new practices or measures was well received by the population and they implemented. But we have also situations where the trust was not there. So all these new practices, the new normal. I think Patty might be able to answer better than me in terms of what this new behavior will prevail beyond the pandemic and what are we seeing so far. But I think so far the time and the evidence we have might not give us very conclusive statements, but it might give us a bit of a trend. But I think as the public institutions, we need to continue to promote those good practices of hygiene, hand hygiene, and others to ensure that the next pandemic we are ready. But trust is key.
Good, Patty. Why don't you pick up on this? I'm sure as a global player at RB, you're starting to look at the data that comes in terms of purchasing power, in terms of the hygiene levels and the rest. But are you starting to tap into other sources of data, looking at travel patterns, looking at movements of people into shopping malls, into restaurants, the ability to come out of a cocoon after being locked up for 4 or 5 months? What are you seeing at RB so far, Patty?
I think what we see is that there are big sectors like transport, like hospitality, like sports, where we have to fundamentally work with organizations and help rewrite the protocols. You know, if you think of cricket, sport changes in terms of spitting on the cricket ball before you play. You know, there are real things that we need to work with different parts of society and help them adopt not only what are the right hygiene practices to protect themselves, because I think the greatest under-leveraged thing is the action that each and every one of us can do to protect ourselves and to keep ourselves safe. And while we all wait for a vaccine, we also know that there is a huge skepticism. And I'll talk about the United States now. Only 30% of people in the United States believe that they have the confidence and the trust to take a vaccine. So even when we've got the technology and even when we've got the vaccine, how do we create the conditions under which people trust in order to do it? So I think we're starting at really a behavioral sense and working with whether it's Hilton hotels in order to rewrite the protocols. So every time you stay in a hotel, you know that it's gone through a rigorous cleaning process, to every time you get on a train, in all the taxis in the underground in the UK, to how do we help bring sport back, and how do we help create the conditions under which people can enjoy those things that we all used to enjoy pre-pandemic.
That's a great point. Ashish, you wanted to weigh in, please.
No, I just wanted to follow up on both Bernardo's and Paddy's point on trust and sports. We had an example here in Abu Dhabi itself. We hosted the UFC tournament here in July, where we supported and we participated with multiple governments to facilitate the transport of these fighters into the country, into a bio bubble, by testing them, validating the test protocols prior to coming here, and it was all interchanged. And it was made possible, and the entire franchise trusted the mechanism here, and they've come back here right again in September for UFC 2.0. So definitely there's a strong combination of how do you trust the test results, how do you trust the protocols, and especially to bring back sports back to normal. We're also supporting aviation industries in terms of testing, coming up with new innovative testing technologies, because the biggest problem they have is how do we get a quick turnaround time. So we're working around that to provide them new solutions for that. I'm sure in say by the Q4 of 2020, we should definitely bring back the flights back to normal, especially in Abu Dhabi with our vaccination program, with our new innovative technologies for testing. It should increase by the end of this year.
That quickly, you're saying?
At least that's my personal view, definitely.
Well,
I'm
that's
optimistic about that.
It's a fascinating statement. Yeah. Go ahead, Dr. Jamal.
Well, the word protocol is actually something that we are hearing every day right now. This is one of the things that we need to live with as we move on till we have the vaccine. Right now, opening school require a protocol, opening a mall require a protocol. The government itself needs to create that trust in all the different protocols so it can give the trust back to the community so they can come to the malls in a safe environment. And this is being actually, I'm a member of the local committee that handle all the different decisions not related to the healthcare system, but also the whole pandemic and security issues. One of the daily tactics that we are doing, we will not open any sports, for example, unless we see the protocol first. So we see the protocol, we review it with the public health, all the different stakeholders, we agree on the protocol, we implement it, and we audit. And this is being continuous now for the last 3-4 months. And this is what created the trust in bringing other players in the market here, like UFC and other cricket championship also being here held in Abu Dhabi. So you see, if we follow the protocol, our life will be easier. The moment it is being implemented in the right way. There are some deviation from the protocol, but I believe this is something that we need to live with and implement it as we move on. We need to have our own protocol at home also, when we see our families, how we greet each other. We have a tradition. Right now we stopped doing that because of the new protocol. And this is something we need to continue doing.
Good. Dr. Farida, one thing we didn't cover here and this is also technology and data related because of the research that's out there, we've evolved in terms of treatment of people because the death rates are much lower, right? So we're living with the virus and knowing how to treat. Isn't that an important part of the trust factor that the two of you just brought up in our studio here? That we start to say, look, we know how to treat people better, so the threat of the vaccine, of the virus is not so severe. Is that a fair comment, is it not?
I think the less numbers of deaths that we saw currently or recently due to multiple factors. One of them, in the beginning, the healthcare systems were overwhelmed. We don't see this, we don't notice it very much these days because I think many countries work to increase and expand their healthcare capacities. The other thing is the more efficient, more rapid testing technologies that came. So it enables doctors to diagnose early and intervene earlier. The third one is for sure, the research advancements when it comes to the treatment and to how to intervene early to prevent the complications and to reduce the death.
Okay, I'm going to wrap up here because we have just a couple more minutes left. Dr. Jamal, and then I'll finish off with Bernardo. What could you have done better, do you think? At the front end of the curve, when your system was getting tested, the response time seemed to be excellent. What do you think you could have done better now that you've been hit with such a pandemic you probably never thought you'd be hitting you square between the eyes?
I think I would have increased the capacity of our healthcare system here to accommodate all of these cases because there was side effect because of that. And we did not have the luxury of time to expand as we want. One of the things also to make our system mature enough to handle our emergency. One of the things also I was talking to the team previously is the preparedness of our private sector in handling pandemics. Previously, we used to do all these emergency practice with the government entities. And I think the involvement of private sector would have make a lot of difference.
Huh.
Strategic
So the
stockpile.
response time would have been better.
Response time will be better. We will understand whatever they have. They will understand our capability also. We will work closely together. Actually, this happened in Abu Dhabi, but it will be much better if we would do these exercises previously. The response time will be much better.
Interesting. Ashish, go ahead.
No, I just wanted to just cite that example which Dr. Jamal said. We are an exact example of that. There was a necessity to increase testing capacity here. Yes. We built a lab in 14 days ground up here, and it can test over 15,000 samples on a daily basis. And that was because there was directions, there was progressive regulations, but it was made possible. And that's how the private and public sector worked really quickly there.
Yeah. Candid response, if I can. Was Group 42 ready for this sort of ramp up? Because that's a heck of a challenge in itself, right?
So 3 of us have very difficult calls most of the time, but it was a challenge and it was exciting, and I think we've responded very well. It was not easy, but definitely seeing the results here, all of us are proud of what we have achieved so far.
It's not only the lab itself, the ecosystem around it.
Correct.
Yes.
So you need to bring the resources, all the different testing capabilities in 14 days.
Good. Can you tell me how you train your people when I go into line for the testing? They're so friendly, they're so fast, they get me in and out. But they actually seem like they want to engage you, and they're using the latest technology in the lines to get you in and out pretty quickly. But it's a mindset, isn't it? It's a trust in the system.
I think from the beginning, they appreciated this opportunity. Most of them are volunteers, and they are doing this by themselves from their heart, and they want to be part of it. You will not believe how many people called us in the beginning. They want to help because they are not in the healthcare system, and they see what is all the different countries doing in regard to this pandemic. And each one of them actually wanted to be part of this. So we opened the door for volunteers. We allowed them to work on these centers. And I think they got the experience as we move on. So they improved through the pandemics. And right now you see the outcome when you go to day 4 testing. It is totally different experience from day 1.
Yes,
so
that's for sure.
The pandemic taught us all these different lessons.
Sure, and the outreach and trust is, I think, was very important. Bernardo, do you want to finish on the top 3 priorities from the WHO perspective now to conclude our discussion here? What are the top 3 priorities as the vaccines are getting developed? The persistence in terms of policies, not backing off on R&D. What would you say is the priority from this point forward?
From WHO perspective, the Dr. Tedros launched with a number of heads of state the access to COVID-19 tools, so an accelerator to deal with several areas within the COVID response. So my hope and my call here is that the Abu Dhabi and the United Arab Emirates and other countries join the ACT accelerator, because there are a number of countries already in there, and there's a requirement that addresses this challenge of vaccines, both on the supply chain but also on prioritization, but as well as to address some of the underlying health systems in a number of countries. So joining the ACT accelerator is one. The other is, and we started that with a number of partners, is to look into early warning disease surveillance systems. So when we had systems that we used in the past, including for COVID-19, but I think we can do way better. And there we need the collaboration of countries, but also technology partners, such as one Abu Dhabi is using, to come together to build a system that will allow us, using the lessons of COVID-19, to continue to do the surveillance, because we at WHO we deal with multiple emergencies, at the same time. Currently, there are more than 20 or 30 health emergencies going on. Of course, pandemic is one that is taking all oxygen from others, but we have other ones going on as we speak. So in these two areas of joining the access to COVID-19 tools, where there's a number of partners, but a number of governments that are already joined, but also to work on these early disease surveillance systems. Of course, within that we have other sub areas. Such as what I mentioned before, the dynamic maturity models, to make sure that the investment addresses the need, but also we as I spoke before, the whole digitalization of electronic health records, but as well as immunization health records. So from our perspective, a better in a sense, what I'm saying is that we need a much stronger collaboration and partnership by everyone to really work on a common goal, which is bring, control, and manage the pandemic, but as well as deliver those vaccines to where it's needed. But on the other hand, you use the technology either for predictive modeling to see the different potential curves and potential impact, but as well as early disease surveillance systems to make sure that we do way better next time. So I think I would say these are the three areas.
Good. I like the way you finished on the common goals, because we're sitting in Goals House, right? So I couldn't have asked for a better summary. Before I thank our guests individually, I just want to remind the final session at Goals House in Abu Dhabi will include an excellent session on culture through COVID between His Excellency Mohammed Khalifa Al Mubarak, who's the chairman of the Department of Culture and Tourism, and Dr. Tristram Hunt, the director of the Victoria and Albert, taking place at 1800 Abu Dhabi time. Of course, that's 3-hour difference with London at 1500, 8-hour difference with New York at 10 o'clock in the morning. Let me see if we can have our technical crew give a nice tour of the studio here and thank everybody. Dr. Farida Al-Hosani of the Abu Dhabi Public Healthcare Department, Dr. Jamal Mohammed Al-Kabi, the acting Undersecretary of the Department of Health in Abu Dhabi. Sheesh Koshi is the CEO of G42 Healthcare and how the private sector collaborated here. Patty O'Hare is the Global Head of Communications and Government Affairs at RB, who joined us kindly from London, and Bernardo Mariano Junior, the Chief Information Officer at the World Health Organization. I don't think they could have assembled a better group. Thanks a lot for the invitation, and we'll join us tomorrow night, Abu Dhabi time, for that final session on culture and COVID-19. Thanks very much.